Hello, this is Dr. Meyer. I'm a pulmonologist in practice in Carmichael, California for the last nearly 40 years. And today I'd like to continue our discussion from allergic nose and bronchitis on to allergic asthma. Allergic asthma affects a lot of people, and it's a very significant disease. It's episodic. Some days you can have rather significant wheezing, shortness of breath, coughing, phlegm. Other days relatively quiescent. It can also be triggered by exercise. Some people, when they exercise, they have asthma, and the only time they need treatment is taking a puff of albuterol shortly before the exercise, preventing that particular attack, and then they are good for a long time. As we talked about in hay fever, the same allergens affect the bronchial tubes that affect the nasal membranes, and so we have the pollen during the spring, summer, fall season, and therefore some people have seasonal asthma, like they have seasonal rhinitis. And other people have year-round asthma affecting the wintertime things, which is dust, animal danders, moles, the wintertime pollens, and then if they have that and the pollen, then they have year-round asthma. Asthma is also an inflammatory disease of the bronchial tubes, and there's lots of goblet cells that secrete thick exudate, and it's not just pure simple tightening of the bronchial tubes, but that's the significant part. The muscles around the bronchial tubes reacting to the allergen and causing a release of histamine, which would tighten up the bronchi and also cause all the other symptoms of hay fever and also of asthma. Asthma is more common in people that have a family history of asthma. If both parents have asthma, then it's very likely the children will have hay fever and asthma. If just the mother has asthma, it's more likely that the children will have asthma. More so than if just the father, which is an interesting genetic trait. So the family history is very important, and so one can pretty well pinpoint the cause of the asthma, just like in hay fever, what the symptoms are, and then avoid the symptoms is the most important thing in avoiding asthma attacks, just like avoiding hay fever. So if spring, summer, and fall pollen, then staying indoors and keeping the house air conditioned is very significant. If you have the wintertime asthma, to dust house dust, moles, animal danders, then it's very important to eliminate animals from the house. If that's not possible, certainly eliminate them from the bedroom. We've seen patients that have asthma every night. They crawl underneath their feather mattress and their feather pillow, and they start wheezing, sneezing, and they cough and wheeze all night, and they do that for years, and they have not put together what causes that. It's very simple for the physician to show this correlation right away. Every time you go into your bed, you wheeze, so there's something in your bed or in your pillow that you're wheezing to, and let's get rid of that pillow or the feather bed by evening and get some Dacron polyester pillows and nylon Orlon comforters and eliminate the asthma at night. Most dramatic case that I had was a mother who, just some years ago when I was still seeing some children, her child was really having trouble at night, wheezing, coughing, and snorting, and I went through all the allergens with her, and I says, I think you need to clean up the nursery and get rid of the feathers and the stuffed animals and the stuffed toys. And she told me later that she thought I was absolutely crazy, but she'd been around the block and seen most of the physicians in the community, and so she thought she would try that. Eliminated all the feather stuffed things and Dacron, the K-pop stuffings from the child, and that night, in the middle of the night, she woke up and almost screamed at her husband, "Our son has died, I don't hear him," and she rushed to the nursery, and the baby was sleeping as soundly as ever and never had slept that soundly before. So it's a very dramatic change when you get rid of the pollens that you're allergic to in the bedroom. The same thing for animals. Some people go into a house They can tell right away there's a cat in the house or there's a dog in the house. The other thing is cockroaches are very important in allergens, and so we have to make sure we have no food in the bedroom and get cockroaches that come into the house, because they can be very significant in causing asthma. And of course the other thing in asthma is fumes and pollution, burning wood, gases, tobacco smoke. These are relatively less important in hay fever and more important in bronchitis and asthma. And so that becomes very important in the industrial and occupational environment. And so we see a lot of occupational problems, and we have to look at the workplace. And that's why many pulmonologists also are involved in occupational medicine, because it's very closely related. And if the person works in a sawmill or in a dusty place or asbestos exposure, it's very important that that be eliminated and they be cross-trained into a more clean environment if at all possible. So the goal, the evaluation of the patient with asthma is then checking the lungs for wheezing, and then the symptoms, the history, the chest x-ray to make sure there's no pneumonia or other things causing infection, and then the breathing tests that we do. We do a lot of breathing tests in the people that have hay fever, because we found that more than half of the people with hay fever also have subclinical asthma. They wheeze but don't really realize they wheeze. The other day I saw somebody who thought she had no asthma, and I did a breathing test on her. Her pulmonary function showed that her airways were only moving 30% of the air that they should be, and so she had rather significant allergic asthma that was subclinical and not recognized. People don't realize you have to be below 50% of normal before you may appreciate. But those are the people that we can help the most by preventive measures. So we control that by avoiding the inherents, and then if they have that kind of asthma, we give them controllers, steroid inhalers, and long-acting bronchodilators. And we encourage the patients to take that every day, even on the days they don't think they're having trouble, because as we demonstrated, the day that they didn't think they have any trouble, we demonstrated rather significant disease. And so prevention involves taking care of the whole house, whether it's covering your bed with plastic, covering your pillows, or changing Dacron polyester, change the type of detergents you use without the odors, keep the humidity down, keep the temperature down, and get the carpets out of the bedroom, if not the entire house, because they collect a lot of dirt and dust, and can be a constant source of it. Get rid of all the feather products in the house, and take a look at the animals, and if all possible, remove them from the house. Sometimes you can make the clinical correlation right away. When you put your dog or your cat towards you, they get hay fever symptoms, nasal congestion, tearing of their eyes. So we don't need skin tests to demonstrate that. The patient has demonstrated that for us already with the contact. And eliminating tobacco smoke, and sometimes we have to put filters around the outside of the furnace if it's an old house and the flues haven't been cleaned. And so the important thing is to avoid air pollution, industrial dust, all irritating fumes, and all potassium allergens. That's it for this week, and we look forward to talking to you again next week.